Hello everyone, welcome to CFA का podcast. आज हम बात करने वाले हैं अमेरिका से आए मेरे दोस्त से. जी हाँ, मेरे साथ जो शख्स बैठे हैं इनका नाम है डॉक्टर अभिषेक. मेडिकल ऑन्कोलॉजिस्ट है, कैंसर स्पेशलिस्ट जिसे हम बोलते हैं. और कुछ टाइम इन्होंने निकाला. मैंने कहा डॉक्टर साहब कुछ भी करो, थोड़ा सा टाइम हमारे बच्चों के लिए, हमारी जनता के लिए देना पड़ेगा. कुछ इनके क्वेश्चंस हैं जो मेरे लेवल के ऊपर चले जाते हैं, तो डॉक्टर साहब आप थोड़ा सा टाइम दो. आज इस पर हम बात करेंगे फिटनेस की, ओबेसिटी की, और कैसे कैंसर और जो वेलबींग की हम बात करते हैं कैसे वो रिलेटेड है, सिंस ही हैज डेडिकेटेड हिज लाइफ टू कैंसर एंड ट्रीटिंग पेशेंट्स ऑन कैंसर. तो उनका जो एक इंसाइट होगा उसके बारे में बात करने वाले हैं. तो एक बहुत इंटरेस्टिंग कॉन्वर्सेशन होना है डॉक्टर साहब के साथ. आपके भी अगर इसके साथ साथ कुछ क्वेश्चन आएंगे तो नीचे कमेंट बॉक्स पे डालते जाना. बट लेट्स वेलकम आवर गेस्ट डॉक्टर अभिषेक. डॉक्टर साहब, हाउ आर यू?
Hi, thanks for having me. Just an introduction. I'm Dr. Abhishek Marbali. I'm a medical oncologist and a hematologist. I'm practicing in the state of Washington in the United States. Um, I have been practicing for the past 17 years and I take care of cancer patients. So what we as medical oncologists do is we look at all the data and all the research, and then we try to utilize that data and research to diagnose and treat cancer patients. During this entire period of time, we realized that each cancer patient is a unique individual, and we have to treat them based upon what their needs are as a part of personalized medicine.
So डॉक्टर साहब, टेल मी समथिंग हियर. व्हेन यू से कैंसर, यहाँ पे कैंसर का मतलब होता है कि डेथ मेड, ठीक है. और बहुत डर जाते हैं. आई लॉस्ट माय मदर टू कैंसर, आई स्पोकन टू यू, सो रिमेंबर. एक लेवल इंसान वो एक सड़क पे चलते आदमी को मुझे बताना है व्हाट इज कैंसर. क्या मैं उसको बोलूँ कि उसको समझ में आया कि ये कैंसर है और इसका इलाज आज पॉसिबल है, कैसे प्रिवेंटिव साइड पे पॉसिबल है, एंड यू कैन गिव अ बेटर इनसाइट ऑन दिस.
हमारे शरीर में जो सेल्स होते हैं ना, वो नेचुरली डिवाइड करते हैं, और एज टाइम पैसेस, एज अ पर्सन एजेस, जैसे सेल्स डिवाइड कर रहे हैं, एक मिस्टेक करने पे हो जा रहा है. एंड दिस मिस्टेक कैन हैपन बिकॉज ऑफ सेवरल डिफरेंट फैक्टर्स. One mistake that happens, it can change the genetic structure of that cell and then make that cell keep on multiplying. And this now cell does not listen to any part of your body. And it keeps on forming clumps of these useless cells and starts damaging organs. And then they start moving to different parts of your body, damaging those organs. So overall, it takes over your body. And that's basically what cancer is.
So does cancer mean a death sentence?
No, so cancer is very, so it's very, very different. Each cancer is very different. There are so many cancers that, don't even need treatment. These cancers, they can stay in a person's body and we don't even do anything for it and they live a normal life.
Okay.
There are cancers that can be very aggressive and need very aggressive treatments, but you're able to cure those patients.
Indeed.
Yes. Now, there are so many subtypes of cancers that need very aggressive treatment and they can be a death sentence. And we are focusing on treating those cancers and trying to find better treatments for them.
Yeah, so we get it. कि अब आपको लग रहा है कि कैंसर है, तो पहले मुझे लगता है कि जैसे आपने बोला कि हेमेटोलॉजी के थ्रू आपको पता चलेगा कि किस तरह का कैंसर है, मेरा ट्रीटमेंट प्लान उसके बेसिस पर डिसाइड होगा. रिपोर्ट आते ही एक एम्पैथी जैसा वर्ड जो होता है बहुत ज़रूरी है. मुझे याद है कि मेरी मदर का जब डायग्नोसिस हुआ तो द गाय हू डिड द पेट स्कैन, आई स्पोक टू द डॉक्टर, मैं लाइक स्टेज 4 है, और हमारे लिए स्टेज 4 का मतलब होता है इट्स अ डेथ सेंटेंस, और अब कल पता नहीं सुबह कैसे होगा. तो मुझे लगता है वो एक एम्पैथी का फैक्टर भी होता है, दैट इज मिस सही. बट दिस इज समथिंग दैट आई ऑल्सो वेंट टू दैट. बट यू टेल मी समथिंग, do you also see any lifestyle related thing that has to do with cancer, or it is genetic only? Do you see any factors, any collaborations here?
Now, I would say the genetic part of it, only 10% of cancers actually are genetic related. And the rest is 90% of them are lifestyle. And what people are exposed to in their lifestyle, their diet, their activity, almost other things. So, yes, lifestyle matters a lot. And with the genetics that you're born with, that only contributes to what ends cancer.
So that means जब भी कैंसर हो रहा है तो 90% हम लोग खुद रिस्पॉन्सिबल है. और 10% हमारा जीन पूल जो है वो इम्पोर्टेंट सकता है when you talk about cancer.
Right. I mean, I wouldn't say I'm खुद responsible है, but it depends upon the situation. Of course,
Yes.
exposed to something, of course, lifestyle choices, foods that they're eating, they might not know what is in there because of lack of awareness, lack of education. These are all part of causing cancer.
So lately I was reading a study doc. उसमें उन्होंने बोला वर्ल्ड बेसिकली फेडरेशन दिस एन ऑर्गेनाइजेशन जिन्होंने भी एक स्टडी दिया मार्च में उन्होंने बोला बाय 2035 okay in the next 12 years or so we will have half of the world's population who will either be overweight or obese. What do you think about this study?
That is a very, very concerning study. Imagine having more than half of the population being obese by the year 2035. Obesity is a very, very high risk factor. Even the WHO recognizes that it's a high risk factor for causing health problems, and it's responsible for over 2.8 million deaths worldwide. So that is something that we really have to address, and there are several methods as to where we can address whether it's lifestyle, activity, and diet.
मतलब हमें समझने की जरूरत है हाफ द वर्ल्ड्स पॉपुलेशन जहाँ पे हम बात कर रहे हैं नॉट जस्ट द रिच कंट्री इन द पुअरर कंट्रीज जहाँ पर ओबेसिटी का रेट बढ़ता जा रहा है और जहाँ पर अब ओबेसिटी के साथ साथ ओबेसिटी इज नॉट द प्रॉब्लम बट इसके साथ साथ जो इसके एप्लीकेशन आएंगे चाहे वो डायबिटीज़ को लेकर है चाहे वो हाइपरटेंशन को लेकर है चाहे वो कैंसर को लेकर भी अगर है सो व्हाट डू यू थिंक अबाउट दिस रिलेशनशिप
So definitely obesity is one of the things that actually leads to cardiovascular diseases. It leads to musculoskeletal diseases. It increases the risk of certain cancers. So if we can address obesity, it can lead to prevention of other types of diseases significant.
सो डेफिनेटली ये ओबेसिटी का जो ट्रेंड आया है और आई एम श्योर इंडिया में आपने देखा ही है और यूएस पे भी आप देख रहे हो यू ट्रैवल अबाउट आई एम श्योर तो उसमें और कंट्रीज में क्या ट्रेंड आप देख रहे हो ओबेसिटी के साथ इज इट जस्ट द इनएक्टिविटी or the other factors also that you see smoking, drinking, cultural wise, how do you see all that?
I would say what we say multifactorial, which means there are so many different factors, what a person is brought up with, what they're used to eating, what their lifestyle is, their jobs, and the activity that they're able to do. So it's a combination of things. But I would say in the end, it comes to awareness and education. And every person has the opportunity to look at that, get a better understanding of their own body and make changes accordingly, whether it's what they're eating or whether it's how much activity they can do.
But you see this changing happening everywhere in the world, not just in India or not just in US, all the other countries also that you're seeing?
Absolutely, yes. I would say in the US, people are getting more and more aware of what their diet, about their nutrition, about their activity levels. But, there are a lot of constraints as to how they can address it.
सी फिजिकल एक्टिविटी मेरे को समझ में आता है कि लाइफ बहुत सिंपल हो गई हमने ऑटोमोबाइल बहुत ज़्यादा यूज़ करना शुरू कर दिए मोबिलिटी व्हीकल्स अब बहुत ज़्यादा डाइटरी फैक्टर्स में अगर हम बात करें कि ये डाइटरी फैक्टर्स है जो पिछले 10 सालों में या 15 सालों में that have changed the way people are eating. Okay, and that may be a reason, and you're going to definitely a reason. That may be a reason that obesity is going up. Do you blame it to junk food? Do you blame it to the fast foods? What do you blame it to?
Absolutely. And I would say, that is something that doctors don't really focus on. And that's what I'm trying to focus on these days. Doctors are mainly focused on diagnosing the diseases and treating the diseases. But I really want us to focus on taking nutrition and using nutrition to prevent diseases and actually treating the diseases to complement the standard of care treatments.
Agreed. The doctors always come first. What about the preventive health care? We never speak about preventive health care. The way refined sugars and a lot of bad fat has gone into our systems. A lot of junk food that has gone into our systems. We want to give an insight on this. The audience की क्या ये जो refined sugars आई जो fillers आई इन्होंने क्या किया हमारे साथ?
Absolutely. So this is a really big problem. For example, refined sugars, high fructose corn syrup, maltodextrin. These are widely used in as a food additive, and they're incorporated in several different foods. And people consume these foods. The FDA itself actually considers things like maltodextrin as a very inert substance and considers it to be generally safe. But then we have several studies showing that this maltodextrin can actually promote illnesses. It increases the risk of intestinal inflammation. And we know that when people have intestinal inflammation, that can be increased risk for other inflammatory disorders, such as chronic bowel disease, chronic inflammatory bowel disease, and obesity as well as a part of the metabolic syndrome.
अब I get it. इतना बुरा है, इतनी चीजें हो रही है, कंपनीज को डालने की क्या जरूरत है? क्यों मुझे लगता है कि माल्टोडेक्स्ट्रिन, और मुझे पता है माल्टोडेक्स्ट्रिन क्या है, बट ये जो जनता है, they want to understand कि माल्टोडेक्स्ट्रिन में और सुक्रोज में या नॉर्मल चीनी है, इसमें कोई डिफरेंशिएशन है, या सिर्फ एक टेस्ट का फैक्टर है कि दोनों मीठा कर देते हैं, एक को बहुत ज्यादा है. मतलब what do you think about it?
So maltodextrin is actually used as a thickening agent, and it also provides sweetness to the food. But the sweetness does come at a price. Now, maltodextrin has something known as a glycemic index.
So doctor, we are discussing about the lifestyle part of it. कि lifestyle में हमने देखा कि nutrition एक बहुत बड़ा रोल प्ले कर रहा है, exercise तो हम करने गए, वो तो समझ में आ रहा है. Lifestyle को लेके मतलब what do you think about it? कैसी जो eating habits हैं, या जो junk food बोलते हैं, या QSR हम बोल रहे हैं, quick service restaurants, कैसे we are spoiling the diet? How it is? What do you think about it?
Right, so a lot of these foods have added sugars, added refined sugars, such as high fructose corn syrup. It has added maltodextrin. These are products that are usually considered safe by the FDA, but they do increase risk of intestinal inflammation. When it does increase risk of intestinal inflammation, it can lead to diseases such as chronic inflammatory bowel disease, increased risk of obesity, increased risk of metabolic syndrome. So these things that are added to foods can definitely cause issues.
Okay. Why do you think they are adding, instead of the regular sugar, they are looking at maltodextrin, or they are looking at any other filler? What do you think? What is the reason that they want to fill it with these things? If you have an option to, let's say, fill it with sugar, or if you have to fill it with maltodextrin. मतलब कुछ एक चीजें मुझे पता है, but अगर आप इसमें थोड़ा insight और डाल.
Right, absolutely. So maltodextrin is actually a polysaccharide that's derived from starch. What it does is it increases the palatability of food. It makes it more tasty. It actually provides a lot of bulk, and it improves the texture. It is also a thickening agent, and it also provides sweetness. All of this at a relatively inexpensive cost. So it does provide a lot of functions for the food industry, but then it comes at a price for the people consuming it.
तो एक जो मुझे समझ में आया वो एक तो पैलेटेबल है, मतलब टेस्टी बना देता है खाने को, थोड़ा थिक कर देता है. हमें लगता है कि जैसे इंडिया में मैंने देखा कि थिक शेक्स का एक बहुत बड़ा मार्केट है, तो वहाँ पर इसका एक इंट्रोडक्शन मुझे मिल रहा है, सस्ता है. शेल्फ लाइफ भी मुझे लगता है इससे काफ़ी बढ़ जाती है फूड की, कि जो आज खाना बना इसमें, या जो चीज़ इस पर हमने बनाया प्रोडक्ट, उसको लॉन्ग ड्यूरेशन के लिए रख सकते हैं. अगर और शुगर से कंपेयर करेंगे तो वो फॉर्मेंट कर जाएगा, खराब हो जाएगा. तो वो जो शेल्फ लाइफ जब बढ़ रही है एक चीज़ की, तो मुझे लगता है कंपनी का प्रॉफिट बढ़ता है. तो हमारी हेल्थ के ऊपर अगर आप बात कर रहे हो, तो वहाँ पर एक हेल्थ के ऊपर एक बेनिफिट डाल दिया जाता है कि नहीं ये हेल्थ से ज़्यादा इंपॉर्टेंट है कि कंपनी को प्रॉफिट होना चाहिए, विच आई फील इज़ वेरी रॉन्ग. वन सारी कंपनीज इसमें एक पार्ट है, चाहे वो सोडा कंपनीज हैं, चाहे वो गैडी कंपनीज हैं, एंड आई सी दिस. अच्छा, एक चीज़ मुझे बताइए, क्या इसमें कुछ एडिक्शन का भी एक रोल आता है? बिकॉज आई टेल यू व्हाई, आई हैव अ सन हु स्कोर, माय सन इज 4 years old. मैं उसको देखता हूँ, जब भी वो पेप्सी को देखता है ना, गेंस लाइक इसे मुझे चाहिए, तो एक एडिक्शन से भी रिलेटेड रहता है कुछ इसमें चीज़.
Absolutely. The food companies are hitting all the right spots that cause addiction. It's the sweetness, the salt, and the fat. So we are hitting the sweetness part here, and once you get that sweetness, that's what causes the addiction. And maltodextrin is such a product that it has a very, very high glycemic index. The glycemic index of glucose is 100, whereas the glycemic index of maltodextrin is 110.
So tell me something, maltodextrin का glycemic index बढ़ गया, ग्लूकोज ब्लड में आ गया, एक बहुत एक कॉमन मिथ चलता, मिथ भी क्या बन गया, फैक्ट ही है ये कि कैंसर सेल्स gonna eat sugar for their lunch, breakfast, and dinner. How much of that is true, and how has this impacted that growth of cancer?
So I would say the growth of cancer is impacted by several different factors. It's not just the presence of sugar. Now, there is the presence of sugar because you have a lot of your diet from carbohydrates. So there is going to be sugar. It's the spike that's a problem in several cases. When you take maltodextrin, which is a high glycemic index as compared to something that has a low glycemic index, when you have a high glycemic index, there's a high spike of sugar after you eat food. What happens with that is then the sugar falls down very quickly, and then it causes issues with insulin spike as well.
What do you to understand? Well, I'm just trying to understand. You have blood sugar, and you have minimal blood sugar, and there is a point where you have excessive blood sugars. So, will that have a different trajectory for the cancer cell, or it shall behave the same way?
So I would say it should not really impact the cancer cell right there and then at that moment. But on the long run, when you have these spikes all along, it can lead to other issues. It can lead to obesity. It can lead to other cardiovascular diseases. It can lead to diabetes. And all of these combined will lead to increased risk of cancer.
No, if you have cancer, what it's, if I have those spikes very frequently, do you feel the cancer, again, keeping in mind all the factors, and it's a multifactorial thing and it's not one factor.
Right.
Keeping in mind all the factors.
Right.
If my blood sugar is constantly elevated, कि मेरा blood sugar ज़्यादा ही रहता है या मैं diet ऐसी लेता हूँ उससे ज़्यादा रहता है, क्या cancer की spread होने का chance भी उतना बढ़ जाता है?
I would say that is not entirely true. Obviously, I would say I would be more worried about a high sugar causing other issues rather than just feeding the cancer there and then at itself. It can cause damage to your blood vessels. It can cause damage to your heart. It can cause damage to your nerves. Now, cancers are able to adapt and they're able to use whatever nutrition it gets, whether it's a high glucose spike or something that's slowly coming into the bloodstream, it's able to utilize that.
Okay. So they'll find their nutrition.
What does virus nutrition at? So, yes.
So we are talking about cancer and how blood sugars, and you are worried about that blood sugar can lead to obesity, can lead to other problems. And I was also looking at some data earlier today that refined sugars or even fructose or even high fructose corn syrup and all, they're also not just letting you to obesity, but they're also damaging a lot of other things in your body. Do you have any insight on this as well?
Absolutely. So we've actually had studies on this, and these refined sugars, and whether it's fructose or maltodextrin, other things, when they give you a high glycemic index, it gives you high glycemic load. And we have a study where we compared people having a high glycemic load diet versus a low glycemic load diet. And we saw that people that have high glycemic load diet have a higher risk of developing cardiovascular disease. There's a big study, which is a meta-analysis of 24 different studies, and that showed that people consuming a low glycemic load diet had a lower risk of diabetes compared to people consuming a high glycemic load diet. And all of these is combined can affect the health of an individual.
Also, with fructose, there is a lot of discussion and debates about fructose, whether you should take it, you don't take it, because of its love or its affinity for liver and the liver to decide what to do about that. Because in our diet, traditionally, fructose has been very limited because the fruits that we eat are very limited in nature that we used to get. Now, ये companies ने अपना फायदा बनाने के लिए क्या किया, भी इसका sugar cheats कर दिया. और ये भी देखने को मिल रहा है क्या ये ज़्यादा fructose लेने की वजह से liver damage की वजह से मैं कहीं पढ़ रहा था कि वो non-alcoholic fatty liver बच्चों को देखने को मिल रहा है because fructose का intake बढ़ गया. और वो fruits की वजह से नहीं बढ़ा, वो इन सारी चीज़ों की वजह से बढ़ा है. Do you also see that these kind of cases now, when you practice generally?
Yeah, absolutely. So again, it comes back to the point where whether you consume fructose through foods as compared to having fructose through fruits. Fruits contain a lot of dietary fiber, and that fiber reduces the pace at which it's absorbed into your body. Whereas when it's refined sugars or fructose or other things, it's immediately absorbed into your body and gives you that glucose spike.
Yeah. So that is what I was seeing, that even the companies, to just make a little bit of profit, what that have done is they have changed the substrate. अच्छा वो fructose डाल दिया या कोई maltodextrin डाल दिया या कोई और ऐसा सब्सिट्यूट डाल दिया जिससे कि खाना टेस्टी बन गया, ये चीज़ हो गया। पर अब एक एज अ पेरेंट, अब मैं कैसे समझूँ कि ये चीज़ मेरे लिए अच्छी है या मेरे लिए बुरी है? अब जैसे ये आप बता रहे हो कि ये डायबिटीज़ के लिए वो कर रहा है, कोई ऐसी भी स्टडी है तो ये बोल रही है कि अगर मैं इसको लॉन्ग टर्म लेता हूँ तो बच्चे को ओबेसिटी हो ही जाएगा या कुछ ऐसा हो पाए और कुछ ऐसा डैमेज क्रिएट करेगा उस बच्चे के शरीर में, कुछ ऐसा नहीं?
Absolutely. So there are several studies. One we spoke about the fact that this glycemic load, the people that are consuming maltodextrin or the high glycemic index foods, it increases risk of diabetes. It increases risk of cardiovascular diseases. What people can actually do is either eliminate that, which is very tough, or opt for a healthy alternatives. Now, one of the healthy alternatives is actually oats. So oats is also carbohydrate based. It gives you some things like oat flour or oat grains. They provide you carbohydrate, but it also contains a lot of bioactive compounds, which are very beneficial for your health.
So you're talking about oats, the wonder grain, huh? Not that. Okay, so you think oats can be a replacement to all these things? You think that ways?
Absolutely. So instead of using refined sugars, instead of using maltodextrin, if those carbohydrate bases are based with oats, it can provide a lot of benefits.
So I was talking to a friend who is into manufacturing supplementation. I mean, he did the formulation. He was telling me कि बहुत बड़ा हमारे देश में even worldwide ये problem है कि वजन बढ़ाने के, एक तो दुनिया है जो वजन घटाने के लगी हुई है कि मुझे वजन घटाना है। एक ऐसा ही ग्रुप है जो चाहता है कि मेरा वजन बढ़े। They are underweight or they are very thin and they want to increase their BMI. तो क्या होता है, एक कैटेगरी ऑफ सप्लीमेंट्स आते हैं, आपने सुना भी होगा वेट गेनर्स के बारे में। अभी जो माल्टोडेक्स्ट्रिन आप बार बार बोल रहे हो ना, जब ये बच्चे जो है देख रहे हैं, ये जाकर वो डब्बा देखेंगे ना, उसके पीछे लिखा होगा माल्टोडेक्स्ट्रिन। अब उनका क्वेश्चन अगला ये होगा कि सर ये माल्टोडेक्स्ट्रिन क्यों डाल रहे हैं वेट गेनर्स में, और शायद उनको आंसर मिलेगा, बट फिर भी आप एक्सप्लेन कर दो कि वो डालने की क्यों जरूरत पड़ रही है माल्टोडेक्स्ट्रिन यहाँ पर एक वेट गेनर।
Well, again, it comes down to the fact that it's addictive. It provides a good palatability. It's relatively inexpensive. It gives it a good outfeel. So all of these things, tell companies that hey, we should try use these products.
तो डेफिनेटली ये जो चीज़ आ रही है ना कि मुझे कैलोरीज का बल्क चाहिए कि एक सर्विंग में 300-400 कैलोरीज चाहिए। अब अगर उसमें मैं कुछ अच्छी चीज़ डालता हूँ तो उसकी कॉस्ट बढ़ती है, तो मुझे क्या करना है कि कैलोरीज तो देनी है, पर वो कैलोरीज देने के साथ साथ मैं क्या कर रहा हूँ, बीमारी को दे रहा हूँ। मैं वेट बढ़ाने की तो कोशिश कर रहा हूँ, पर जैसे डॉक्टर साहब ने भी बोला है कि जब वेट बढ़ रहा है तो साथ साथ क्या बढ़ रहा है, आपका ओबेसिटी का चांस बढ़ रहा है, आपके डायबिटीज़ होने का चांस बढ़ रहा है, आपके कार्डियोवैस्कुलर डिजीज होने का चांस बढ़ रहा है। तो आप एक अच्छी चीज़ ले रहे हो अपने हेल्थ को बढ़ाने के लिए, बट साथ साथ ये क्या हो रहा है कि आपकी हेल्थ को और खराब करने वाली चीज़ हो सकती है। व्हाट डू यू थिंक अबाउट मे बी replacing that maltodextrin with any other alternative? एक तो मुझे लगता है आपको ओट्स बहुत पसंद है, मुझे भी बहुत पसंद है, मेरा भी ब्रेकफास्ट कोई, बट what else? You think oats is the right choice at this time?
I would say it's a very, very reasonable choice. Not only because it has a low glycemic index, as I said, it has a lot of bioactive compounds. One of them is beta-glucan. Beta-glucans, it has other things like stenols, tocols, phenolic acid, just to name a few. And, as we spoke, example, diabetes, it's a huge problem worldwide. Beta-glucans have shown to reduce the risk of diabetes. When we look at India itself, over 70 million of the population in India has diabetes. And it's projected that this number is just going to increase in the upcoming years.
Yeah, it's touching 100 billion very soon. They're saying it's touching 100 billion, and we're becoming the diabetic capital of the world.
We're absolutely the diabetic capital of the world at this point.
Yeah, because of the food choices that we're making. And adding to that food choices is the maltodextrin. Or whether it's refined sugar, whether it's fructose, what the companies are using. किसी तरीके से खाने को एडिक्टिव बनाए, खाने में कुछ ना कुछ ऐड किया जाए और जिसकी वजह से ये सारा प्रॉब्लम हो। तो अगर एक ओट्स रिलेटेड ब्लेंड आता है तो आपको क्या लगता है कि दैट विल बी मच मोर न्यूट्रिशियस? तो ये तो हमने बात की कि अगर हम खा रहे हैं तो इससे प्रॉब्लम क्या होगी। बेनिफिट्स पे जैसे आपने बात की बीटा व्यू पॉइंट इन सब चीज़ों की, बट डाइटरी फाइबर एक ऐसी चीज़ है मुझे लगता है जो हम बहुत कम बात करते हैं. We don't even talk about dietary fibers. कितने important है वो gut clearance, वो कोलन की जो हम हेल्थ की बात कर रहे हैं वो कोई बात ही नहीं कर रहा. कोलन कैंसर का रिस्क आप मतलब मेरे से बेटर जानते हो इस चीज़ से, और कितना बढ़ गया है पिछले 10 साल में. लास्ट decade it was all about colon cancer and polyps बढ़ा है, इसको कुछ हो रहा है. So maybe this is also because of less taking of the dietary fibers.
Absolutely, you're absolutely right. So as you just mentioned, the beta glucans. In fact, the European Commission has validated a suggestion to use dietary fiber or anything that can be beta glucans, such as oats. Use about 4 grams of it added to every 30 grams of carbohydrate that we consume. And this decreases the postprandial glucose, which means the amount of glucose that will spike in your blood after you had a meal. So that is one of the suggestions of the European Commission.
So, when we are on this topic of dietary fibers, tell us something related to colon cancer and how the preventive side of it, about related to dietary fibers. I've read about it, but again, if you can explain something on this, on my advice also.
So there are certain compounds. Now, there are several studies that actually show some of the compounds in dietary fibers decrease the risk of colon adenomas and colon cancer. Not only that, some additional compounds in oats have some anti-cancer activity against skin cancer cells. There's some anti-cancer activity against lung cancer, plus a few other cancers. Although there still needs to be a lot more studies to delve into that part. But yes, colon cancer is one of the cancers that is actually preventable. And it's very, very important. If we can prevent the cancer, prevention is better than cure. So we should prevent it. So recommendations for everybody: avoid red and processed foods, increase your risk of dietary fiber, increase your intake of dietary fiber, and start getting a colonoscopy at the age of 45. The guidelines have actually decreased the age. And if you have a family member that has a family history of colon cancer, it's very important that you tell the doctor that a family member has colon cancer. That way they will get a colonoscopy or a test to about 10 years before that other family member had the cancer, so we can prevent it in these individuals.
So, preventive side में जब हम बात कर रहे हैं कि कोलोनोस्कोपी कराना है, आपका ग्लोस्कोपी 40 की एज से पहले करा लिया, डाइटरी साइड उस टाइम देख पड़ा लिया, हमने प्रोसेस मीट की तो सभी बात कर रहे हैं. WHO भी टू एक एकेडमिक न्यूज़ को डाला है कि प्रोबेबली कॉजेज ऑफ कैंसर में रेड वीट आ रहा है. सो डाइटरी फाइबर्स डेफिनेटली इज वन थिंग दैट वी शुड इंक्रीज. यही हमारे हाथ में. अगर आप डाइट की बात करो जो रेगुलर हम टेक करते हैं, स्पेशली इन इंडिया रेड मीट का कंजम्पशन बहुत ज़्यादा नहीं है, राइसी वाइट मीट ज़्यादा है. तो डाइटरी फाइबर्स में ये विटामिन कुछ क्या हमें बात करी. सो एनी रिकमेंडेड डोजेज दैट यू वांट टू गिव कि इतना हमें कंज्यूम करना है, let's say 4 meals लेने हैं, तो उसमें से एक मील should be let's say oats, that will cover up the dietary fibers, or you feel कि इससे extra भी कुछ और करने की जरूरत पड़ेगी?
In general, as I mentioned, about 4 grams of dietary fiber or beta glucans containing dietary fiber with every 30 grams of carbohydrate that you consume. So that is always very helpful.
That is always very great tips. So I think if there is a product, something like this, where oats comes with protein, I think I will take care. But that will help our dietary, क्योंकि मुझे जो लगता है कि इवन जो प्रोटीन भी ब्रेक डाउन हो रहा है बहुत जल्दी, उसका भी एब्जॉर्प्शन जल्दी नहीं हो पा रहा. तो अगर एक ऐसी चीज़ बन गई जिसमें ओट्स के साथ या किसी अच्छे ड्रिंक के साथ उसे ब्लेंड कर दिया, तो मुझे लगता है कि वो भी एक अच्छा मील वाला काम करेगा. तो अभी तक क्या होता है कि जो मील रिप्लेसमेंट आता है बहुत ज़्यादा रिफाइंड होता है, और उसमें भी वही प्रॉब्लम्स हैं जो माल्टोडेक्स्ट्रिन या फ्रक्टोज या रिफाइंड शुगर्स की हैं, जो इवन अब आपको ये मील रिप्लेसमेंट में मिल रहा है. What do you think about the meal replacement shakes out?
Absolutely. I think that's a pretty good solution and well said. We can replace some of these refined sugars and the carbohydrate basis with something like oat flour that could solve a lot of problems and prevent a lot of diseases.
Also, Doc, I was reading about in low-grade inflammation that it can also be the precursor for diabetes. Even diseases like polycystic ovarian syndrome, PCOD, PCOS in females, even lower levels of testosterone. Even you also mentioned initially, if I remember correctly, some intestinal inflammation we were also talking about initially, that because of taking a lot of simple sugars or refined sugars, even there is some kind of inflammation or irritation that is also happening around your intestine.
Absolutely. So all of these refined sugars, what they do is they do promote is the cell inflammation, and that leads to a variety of different diseases. bowel diseases, chronic inflammatory bowel disease. It can increase the risk of metabolic syndrome. So, yes, these intermediate disorders can cause other diseases in general.
So if we replace that portion of sugars with, let's say, a grain that has got good amounts of dietary fibers, do you think we can prevent all that?
I think it would definitely decrease the risk of that happening, because one is you're taking away a substance that causes it, and then you're adding a substance such as ores, which actually decreases the risk of other diseases. I think that's a very good solution and a good alternative.
So now let's talk about the kind of population that you have been seeing in the last 17 years. कैसे लोग हैं वो आ रहे हैं आपके पास कैंसर के लिए पिछले 17 सालों में? क्या उनका डेमोग्राफिक्स चेंज हुआ है? किस तरह के लोग आप देख रहे हैं?
I would say we see people from all different walks of life. Now, what has changed is our treatments. It has come a long, long way. And with all of the newer studies and all of the newer research that we're having, the standard of care treatment keeps on changing. Stuff that I was treating my patients with, say, about 3 months ago, now I'm treating with a completely different agent because now I have new data. And this is going to be obsolete in about 3 months again. We previously used to use exclusively chemotherapy. Now we use solely different things. We use immunotherapy, where we use medications to stimulate the person's immune system, and we tell the immune system to go and fight the cancer. We have targeted agents where we look for markers on cancers, and then we have medications that zooms in like a learning missile into the cancer and kills the cancer separately. So we have come up with a lot of innovative ways, and now we have something known as CAR T-cell therapy. This is completely next generation. What we do is we take a person's immune cells, take it out, and put it into a training camp. We train those immune cells, and then we infuse it back, telling those cancer cells, go and kill that cancer. And these are some really good researches, some really good medication treatments that we have, and the landscape of treatment of cancer is completely changed.
अब इसने immunity के cells को बाहर ले जाके train करो, उस वापस अंदर डालो, one fight cancer.
Absolutely.
But honestly, doctor, what do you think in the next 2 decades or so? Be very honest with you. लगता है cancer को हम treat कर लें? कुछ ऐसा मतलब, I know very controversial, I know very, we don't know, people don't have answer to this, but generally if I ask, 20 साल में ऐसा होगा कि हम बोलेंगे जैसे आज हम HIV के लिए बोलते हैं कि अब curable है or at least manageable है, we can live a normal life. Do you think we could say that for cancer also in the next 2 decades?
You know, it's a very good question. But I personally think we can at least reduce cancer to something like a chronic disease. To bring it down to something that can be managed for a person's lifetime, he just takes some medications to keep it suppressed. So right now, I would say a lot of cancers, most cancers, when they part early, they're curable. There are certain stage 4 cancers that are very curable. The lymphomas, we catch it in the stage 4 and we have the very, very high cure rate for that. There are some other cancers that at stage 4 we are not curing, but people are living way longer now with those cancers compared to people stage 4 cancers several years ago.
मतलब लाइफ एक्सपेक्टेंसी बढ़ी है, 5 year period, 10 year period, ये सारी चीज़ें बढ़ी है. थोड़ा सा ना आप मैं बात करूँगा बहुत स्पेसिफिक एस्पेक्ट. आई लॉस्ट माई मदर टू ब्रेस्ट कैंसर, और मैं जब उसके बारे में पढ़ रहा था, मैं देख इतनी सारी बेसिक चीज़ें कि ये टेस्ट कराओ, ये प्रिवेंटिव साइड पे ये चीज़ कर सकते हैं, मतलब उसमें को बेसिक भी जो पढ़ पाया. मतलब जस्ट लेट्स टॉक अबाउट ब्रेस्ट कैंसर फॉर अ बिट. कि व्हाट डू यू थिंक, क्या अभी चल रहा है, क्या उसकी प्रिवेंटिव साइड हो सकती है, एंड ऑन द रिसर्च पार्ट वेयर आर वी इन ब्रेस्ट कैंसर?
Absolutely. So, first of all, I'm sorry to get that about your mother. Unfortunately, breast cancer is very common. 1 in 8 women will get breast cancer during their lifetime. So that's a pretty high rate, 1 out of every 8 women. But fortunately, breast cancer is preventable, or not preventable, early detectable, and then we can act on it to cure it with a very high rate of success. How are that preventable for? That's hard, but yeah.
So just say that like
Yeah, word. So 1 out of 8 women is going to develop breast cancer. And this is a very high number. But we have a lot of pathologies to detect cancer at a very, very early stage. And if we do that, there's a very high chance that we can cure it. So we do recommend that all women get their mammography done. Start at the age of 40. Previously, we used to do regular screening mammographies. Now we have 3D mammography, which is the next orphan, but detects cancers more. It has more sensitivity in detecting cancers earlier. We have to look at family history of it. There's any kind of genetic association. They need to inform the doctor so we can check the plenty of genetic disorders and detect it early.
So when you talk about the prevention, mammography, one ये दो मतलब हम सब समझते आ रहे करते आ रहे कराता कोई नहीं है बट करते हुए आ रहे हैं लोग बट लाइफस्टाइल को कैसे आप इसको बोलते हो जैसे मैं जब पढ़ रहा था फॉर माय मदर आई थॉट आई एम नॉट श्योर क्या था इवन बिकॉज जेनेटिक कोई म्यूटेशन नहीं था शी वाज एन एस्ट्रोजन पॉजिटिव पर्सन तो ओबेसिटी का एक रोल आप मानते हो इसमें
So definitely, obesity has a big role in this. A lot of the cancers are what we call ER and ER positive, where the estrogen receptors are being stimulated by the excess estrogen in the person's body. And fat cells are also responsible for producing this estrogen. So obesity does play a role in increasing the person's risk of getting cancers, especially breast cancer, other things like endometrial cancer, and these are all associated.
कि फैट सेल जो है वो ही एस्ट्रोजन लगा रहा है मेनोपॉज हो गया फीमेल का मेंस्ट्रुएशन साइकिल खत्म हो गया एस्ट्रोजन ड्रॉप करना चाहिए तो नेचुरली ड्रॉप कर रहा है बट उनका अपना फैट से एस्ट्रोजन बना रहा है और अब वो अपने लिए दुश्मन बन गया और अपना फैट सेल हमारे लिए दुश्मन बन रहा है और उसको हम कैरी कर रहे हैं उसको हम एक बॉडी शेपिंग की बात कर रहे हैं बोल रहे हैं बॉडी पॉजिटिव आप ये नहीं समझ रहे हो कि इसके लिए आपको कितना नुकसान हो रहा है ये ब्रेस्ट कैंसर तो मैंने पढ़ा है और ऐसे हम श्योर बहुत सारे और तरीके के लाइफस्टाइल कैंसर्स हैं जो आ रहे हैं जो इस चीज़ की बात कर रहे हैं एक और जो हम आजकल बहुत कॉमनली मैं भी देख रहा हूँ लंग कैंसर चाहे युवराज सिंह की बात हो या वही इन सच लंग कैंसर
Absolutely. So there is some new recent guidelines say that we can detect lung cancer earlier. Anyone who has a smoking history, they need to inform their doctors, and we can start screening CT scans at the age where we detect the lung cancer pretty early. So we have come a long way in treatments of those cancers, and we can cure them at a very early stage. So it's very important. One is you can decrease the risk of it. Stop if you're smoking. Stopping smoking is a huge risk factor for like cancer, as everybody knows.
So doc, let's say somebody was a smoker, now is left it, and lifestyle changes कर रहा है. Do you think that will also impact, that will also lessen his chances of getting lung cancer? Again, you said preventive करना है, लोगों को टेस्टिंग ज़्यादा करनी है, और सबसे बड़ी बात जो मेन कारण है स्मोकिंग, उसको छोड़ना. जैसे अब इंडिया में पॉल्यूशन का एक बहुत बड़ा रीज़न है कि पॉल्यूशन ज़्यादा है, तो इसको कैसे हम इम्पैक्ट कर सकते हैं? क्या कार्डियो एक्टिविटीज मतलब किस तरीके से वी कैन लुक एट कि इसका प्रिवेंशन हो सके एक्सेप्ट टेस्टिंग?
Well, I would say yes. No matter when you stop it, if you stop smoking, it will definitely decrease the risk of lung cancer. Not only with that, when we do that, it'll also decrease the risk of other disease, which is cardiovascular disease. So that is very important, even if you still for a long time. Now, exercise, putting exercise about 3 to 4 times a week does decrease the risk of not only some cancers, it decreases the risk of breast cancer. Alcohol, sometimes actually. So it's been seen that adding more than 3 drinks of alcohol per week increases the risk of breast cancer. So yes, there are definitely certain lifestyle changes that people can do to decrease their person risk of cancers.
And one more type of cancer that I'm seeing a lot in these days in males is about prostate cancer. क्या इसका insight है prostate cancer? What do you see? What are the trends that you see? क्या लग रहा है? क्या इसमें हो रहा है?
So now prostate cancer is something that we can detect. We can detect it very early, but it's a little controversial. That when we start doing something as PSA screening, we start detecting a lot of prostate cancer very early, and then these patients end up getting procedures. They end up getting biopsies, and they end up getting a treatment or unnecessary procedures for a cancer that might not cause them any problems in the future. Because prostate cancer can be aggressive, or it can be just something that is very common and might not affect the individual during the entire life. So I would say talking about PSA screening, which is to detect prostate cancer early, is something that a patient has to do with a doctor and come to a mutual agreement and decide, okay, this is the age I'm going to do. These are the risks of screening it. These are the risks of actually catching it early, because it may not trouble you in the future. But on the other hand, if we catch it early, we have a high chance of curing it.
क्योर अब जितना जल्दी जितना प्रिवेंटिव इसको कर सके वो करना चाहिए. तो डॉक्टर एक चीज करते हैं, 5 ऐसी चीजें निकालते हैं फॉर मेल्स और फीमेल्स जो करनी चाहिए. ये हमारे हम रूल्स है कि ये करना ही है. डाइट हो गया, एक्सरसाइज, इस तरह की 5 चीज और कुछ टेस्ट जो आप बता रहे हो इन सब के बारे में. 5 things you want to say.
Well, I would definitely say exercise is very important. Doing any kind of exercise for at least 3 to 4 times a week is very helpful. Maintaining a normal body mass index is also another thing that would decrease the risk of some cancers. I would say limiting alcohol is also very important. And in diet, your diet, including dietary fiber, including vegetables, having a very balanced diet is helpful. There's a study showing that a consumed Mediterranean diet decreases the risk of cancer and cancers. So that is something that will also be helpful. And then obviously screening. Screening is something that every patient has to deal with. We can prevent cervical cancer with screening. We can prevent colon cancer with screening. There are so many cancers that we can detect early and prevent any kind of further damage before it causes it to.
तो मेजरली अगर मैं देखूँ डॉक्टर हमारी कॉन्वर्सेशन का जब एंड तो ये भी कही जा रहा है कि डाइट एक बहुत इंपॉर्टेंट पार्ट है. उसमें डाइटरी फाइबर्स एक बहुत इंपॉर्टेंट पार्ट है. प्रोटीन भी बहुत इंपॉर्टेंट पार्ट है. एक्सरसाइज, वेट ट्रेनिंग भी लाइक रिपोर्टिंग टू बी. और कैंसर की अगर बात करें तो प्रिवेंशन एक बहुत बड़ी चीज़ है जो हमें करने की ज़रूरत है. कोई ऐसे ब्लड टेस्ट भी हैं डॉक्टर जो आप चाहते हो कि काफ़ी जो रेगुलर का है?
So that's an excellent question. Now we have upcoming blood tests that could potentially detect cancers at a very, very early stage. As of right now, none of those tests are available right now. But that is actually going to the future. Right now, we are mainly doing certain blood tests, yes, for prostate cancer is helpful. We're doing certain blood tests, we can catch myeloma, we find by doing routine blood tests. But there's one blood does not fit all. We cannot do a single blood test saying that, oh, we are detecting this cancer. But we have a lot of tests upcoming in the pipeline, which should be approved. I don't know when, but hopefully soon, where we can actually detect cancers at a very, very early stage.
But any 5 what kind of blood test that you want everyone to do every 6 months? For example, blood count हुआ, HbA1c हुआ, कोलेस्ट्रॉल हुआ, इस तरह की कोई चीज़ अगर आप बताना चाहेंगे, ये 5 टेस्ट या 10 टेस्ट तो हम सबको कराना चाहिए. मुझे लगता मैं जो अपने क्लाइंट्स को बोलता हूँ ये पैसे हर साल रखो और ये वेस्ट कर ले ही वेस्ट. ये होने चाहिए, इसको खराब करना है, इसको मानो कि ये पैसे मैं खराब करूँगा मैं.
And again, that brings us to a point that everyone is not the same. Everyone should not be getting the exact same final 6 tests. It's something they have to discuss with the doctor. But in general, yes, when you talk to your primary care provider or your primary care physician, they would want the regular CBC, which is the blood count. They would want the CNP, which looks at the kidney liver function or electrolytes. Most of the time, they would get a thyroid panel, which looks at a thyroid, your hormone, your endocrine system, and HbA1c will detect your diabetes if a person is diabetic or not, and then individualized based upon their current health conditions.
तो ये छोटी छोटी चीज़ों को चेंज करके आप जिंदगी में इतने बड़े चेंजेस ला सकते हो. आप सोच रहे हो छोटी छोटी चीज़ है, क्या होता है टॉप वेरी आई वुड से एथिकल वर्ड में ही शायद यूज करूँगा कि जब अभी अब तो हमें पता होता है आप when you're young you take chances की डाइट भी खराब कर दिया, स्मोक भी कर लिया, but you see patients towards the end of their life. Okay, I'm not sure to ask this question or not, but do you see that regret कि मैं अगर उस टाइम भी चीज़ें ठीक कर लेता तो शायद मैं आज यहाँ ना.
So yes, that is a very tough situation. I do see patients coming and telling me, "Doc, am I die or do I have cancer because I've been smoking all of this time?" It not only adds to the misery of the disease, it also adds guilt that I did this by myself. But what I have to say is, one individual doesn't do it to himself. There are a lot of factors that cause all. But if we start paying attention to what we can do now moving forward, hey, let's stop this, not do that, and try and have a better educated population that they know what to do and what not to do, I think that could help us decrease the risk of diseases and other cancers.
मतलब जैसे आपको पता है गाड़ी में सीट बेल्ट पहनना जरूरी, हो सकता है जान ना बचाए आपकी, बट हम अपनी प्रिवेंशन लेके तो चलते हैं ना, स्कूटर बाइक पर जाते हो हेलमेट पहनते हो, इसीलिए पहनना प्रिवेंशन जरूरी है। पर ये गारंटी होती है कि जान बचेगी, ये नहीं होती गारंटी। तो व्हाट डॉक्टर्स आल्सो ट्राइंग टू से इज कि हम इतने सारे फैक्टर्स होते हैं, बट अगर जो हमारे कंट्रोल के फैक्टर्स है उसको हमें कंट्रोल करना बहुत ज़रूरी है, कि डाइट है, एक्सरसाइज है, तो चीज़ों को मैनेज करना बहुत ज़रूरी है। So Doc, thank you so much for taking out this time and being in this podcast. Last 2 lines of wisdom, 17 years of medical practice, 2 lines जो लगता है कि सबके साथ जानी चाहिए, related to exercise, diet, or as a medical practice, anything that we want.
I would say, people usually focus on their job. They focus on making money. They say that they don't have time. But if you don't have health, you really cannot enjoy anything else. So I would say trying to focus on your health, but better, knowing better, educating yourself as to things that you can do, that would be very, very important.
So इस पूरे कॉन्वर्सेशन का सार यही है, चीज़ों को इग्नोर मत कर, आपको एक्सरसाइज करनी है, आपको समय निकालना है। सबके पास 24 घंटे है, हम सबसे ज़्यादा बिजी डॉक्टर अभिषेक है, पर वो भी एक्सरसाइज के लिए टाइम निकाल रहे हैं, वो भी डाइट कर रहे हैं। हमें प्रिवेंटिव हेल्थ केयर की बात करनी है, टेस्ट नहीं कराने से कोई बीमारी ठीक नहीं होने वाली है, डाइट ख़राब होने से आप अपने आप को बेटर नहीं करने वाले हो। अगर आपको लग रहा है कि ये सारी चीज़ें तो मैं शेक हुई या ये खा लिया, रिफाइंड शुगर्स को अपने सिस्टम में इतना डाल दिया कि वो बाहर ही नहीं निकल पा रहा है, तो मैं कुछ अच्छा नहीं कर रहा हूँ। अपने बच्चे को आप इस तरह के शुगर्स दे के कुछ ऐसा उसके लिए कुछ बहुत ज़्यादा रिवॉर्ड क्रिएट नहीं कर रहे हो, उसके लिए प्रॉब्लम्स क्रिएट कर रहे हो। ज़िंदगी में जब आगे जाएगा उसके सारी बीमारियाँ होने वाली हैं। आज हमें रिसर्च बता रहा है कि 50% बच्चे जो है आगे जाकर ओबीस होंगे। ये मेरी या डॉक्टर साहब की बात नहीं है, इसकी स्टडीज़ हैं, इन्होंने पढ़ा है उन लोगों को 10-10, 15-15 साल, और बताया है कि जो बच्चा बचपन में ओबीस रहा है वो आगे जाके भी ओबीस रहेगा, और उसके बाद क्या इम्प्लीकेशन होने वाले वो आपने सुना है इस पॉडकास्ट में। मेरा सिर्फ और सिर्फ यही और डॉक्टर साहब का भी यही आपके लिए मैसेज है कि प्लीज़ अपने डाइट को चेंज कीजिए, डाइटरी फाइबर्स के इम्पोर्टेंस को समझिए, मैक्रोज में प्रोटीन, फैट्स, एसेंशियल फैट्स के इम्पोर्टेंस को समझिए, और अपनी डाइट को उसी प्रकार मैनिपुलेट कीजिए। धन्यवाद।